So case counts from the coronavirus continue to rise nationally and in Pennsylvania. Now here in Philadelphia, our daily case counts over the past week have been stable or increasing slightly. So here are the numbers. Since this time yesterday, we've identified 159 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 27,228 since the beginning of the epidemic. Now in the past week, we're averaging about 115 cases per day. If you want to get a sense for the overall trends, because it does change a lot from day to day, I suggest you look at the graph on our website. And we did have a large number of tests reported since yesterday. And of those people who were tested, about 5 to 6% tested positive. That percentage is another number we're looking at to monitor the epidemic. And the number's been stable over the past couple of weeks. Since this time yesterday, we've identified 2 additional deaths from the coronavirus infection, bringing us to a total of 1,627 since the beginning of the epidemic. Now, in other areas of the country, they're seeing continued rapid growth of the epidemic. It's particularly true in Florida and Arizona and in Texas. Now, initially, those sites could say that they were seeing an increase in cases, but not an increase in deaths. But we know that deaths lag behind cases, and that's no longer true. They're seeing increasing deaths in those states, and we're now seeing increases in the daily count of deaths across the nation as a whole. Now, Philadelphia has not seen those rapid increases or those increases in deaths yet, and we very much want to keep it that way. So to prevent us from having similar increases here without shutting down, what we need is high levels of compliance with our safe mode guidance, our safe mode precautions. There's 8 elements to that. Included in them is distancing, keeping 6 feet from other people, reducing crowds. So that's the reason behind us recommending that people continue to work from home if they can, and that people avoid social events. We know that a lot of the spread around the country is occurring in social events. But those guidelines occur especially important is the use of masks. Let me talk about why. Remember that people can have this virus and can spread it even if they have no symptoms. The virus spreads when people talk or sneeze or cough, and they put out droplets when they do that. What the mask does is it catches those droplets, and so doing, it protects the people around you. We need everyone to use those when they're around other people. Now, we did observations in late June here in Philadelphia. We found that 55% of Philadelphia residents were using masks at SEPTA stations, and in people who were exiting retail stores, the number was 78%. Now, that's good. That's the majority of Philadelphia residents following our recommendations. But it's not 100%. And to avoid a second wave, we need to do better than that. So we need to make masks the new normal. And that's the thinking behind the media campaign that we're launching today. What the campaign does is it serves as a constant reminder to people to wear a mask and also reminds them why they should. And as the mayor said, there are 2 messages. The first message is for us, particularly here in Philadelphia, that despite our differences, despite our opinions, we in Philadelphia do care for each other. And that wearing a mask is a sign that you care about the people around you. It's a sign of respect for others. You may have the infection and not know it. And if you care about others, you don't want to spread the infection to them, and so you wear a mask. So we're the city of brotherly and sisterly love. So that's why the campaign slogan is, as you see over my right shoulder here, love your neighbor, wear a mask. Now that's one image I'm showing you here. Now I'm going to try to share my screen so I can show you more of these images. Just hang on 1 minute.
There we go. That's great.
All right, hold on 1 sec. Okay, that's one image behind me. There's another image there. There are going to be different people of different racial groups and genders in this campaign. And the second message is also ties in us as Philadelphia residents. People of Philadelphia are tough. No one in the city has ever had it easy. But we find ways to fight through tough times. And sure enough, these are tough times now. And masks are what we have to do to fight through them. So the second slogan is, Philly never backs down, mask up. Now, I've done a lot of media campaigns over the years, and the best ones do two things. First, they tell viewers exactly what they should do. And second of all, they show them doing what they should do. And so that's why these messages, these images look like as they do. They show people wearing masks. There's no mistaking what the message is here. Now, because we need to reach everyone, as I said, we're going to have images of, showing men and women, people, all race and ethnic groups, and it's going to be in different languages. So here's one in Spanish, and here's one in Chinese. And the images are going to be in many different locations, especially where the viewers should be wearing masks. So you're going to see them on buses like this, these big, as you see on the side of buses. Here's one of already. Others are going to look like this. One here, and this one here. You'll also see floor decals like this. And there will be in other locations outdoors. We'll also be doing digital ads on social media. We'll be doing newspaper ads, including community papers and radio stations. And we'll be distributing posters and flyers through grassroots outreach. And we're going to continue to remind people at every opportunity. Then we're going to evaluate this campaign, and we're going to continue to monitor mask use, as I've showed you, following up with the numbers that I showed you here. So that's our campaign. And if you want more information about the epidemic, go to www.phila.gov/COVID. I'll be happy to answer any questions later.
The first question, Dr. Farley, is doctors and nurses in Philly are telling us that they're running low on gloves now, as well as the N95 masks, and they say that the test results that they're submitting are taking a week or longer, which leaves people unaware if they're positive and infecting others. I'm curious, are the city testing sites also experiencing a PPE shortage and a delay in results?
So we're not experiencing a PPE shortage at the testing sites. Now, most of the sites are not operated by the city, but the testing sites that we're aware of.
Sir, can you turn your camera on?
I'm sorry, I had it on a minute ago.
Yeah.
There you go.
Are we on now? All right.
Yeah, we're
My
good.
apologies. We are not experiencing a shortage of PPE at our testing sites. And we're looking at our data, and for the testing that we're sending in, we're not seeing delays in the testing. I am concerned about the future, though. I certainly have heard in other parts of the country that they are having long delays in getting and bottlenecks at testing sites because there's so many people who want to be tested, and that they're having difficult shortages of PPE in other parts of the country. So it may be that this will happen here in the future, but we're not seeing it yet.
Dr. Farley, how are the case numbers in the West and the South and their potential need for PPE? Does that play into, do you think, some of the reasons why some of the independent groups, such as the Black Doctors COVID-19 Consortium, might be having difficulty getting gloves and masks?
I mean, it could be. I have just read in the paper of shortages of PPE in the heavy hit part of the country. So it may be that people placing orders now are having some shortages. I can tell you that as of last week, I'm talking to the hospitals across the city that they were all saying that they were well stocked and did not have trouble. But maybe this is the first sign of that the epidemic in other parts of the country is having some impact on us here. Again, I haven't heard that yet, but I'll continue to look for it.
Armando, did you want to provide translation of that?
I did not take the information for that. Mayor, excuse me, Dr. Farley, can you please repeat? I'm sorry.
Rather than do that, why don't we go to Mish's next question, and then Yaima will go to you next.
All right.
Okay. My last question for you, Dr. Farley, is if the rest of the country's spike is having some sort of ripple effect in potentially our ability to get supplies or to provide tests quickly, what does that mean for the pandemic going forward in Philadelphia and in our region?
Well, we have talked to the hospitals about stockpiling supplies so they can be prepared for a surge of patients, or in this case, maybe shortage of supplies. There are other ways to conserve PPE. We have the ability now to have masks be sterilized through a process using hydrogen peroxide. So I do think there are ways that we can deal with this. We certainly would prefer not to. We prefer to not have any shortages at all. But we managed to work our way through shortages when we had our peak back in April. I think we could as well in the future. I wish we didn't have it, but we do have things we can do.
Mr. Mayor, you mentioned how hard it is to enforce mask requirements in Philadelphia. It would seem that it's a lot easier to enforce restaurant protocols. And I'm told that the health department had a call last week with some representatives from different restaurant associations, including Restaurant and Lodging, and that they were told that the city was going to stop, just warning people, but shutting down restaurants. My understanding is that there's only been one restaurant shut down since then. I may be wrong about that. And Dr. Farley, if you have other information, I'd love to hear it. But just walking around the city, I'm sure that you've all seen the restaurants where tables and chairs are too close together and that other protocols aren't in place. Do we need more inspectors to go out on the streets to verify that restaurants are following these protocols? What's the problem here? Why aren't we getting these restaurants to comply? Understanding that there are plenty of restaurants that are doing the right thing. There are a lot that aren't, and they're going to jeopardize it for the rest of them.
Doctor, I think you're more.
Yeah, I can take that question, Mayor. So when the restaurants first started having outdoor dining, I was concerned about that, just having seen with my own eyes some restaurants that were not following the guidelines. Since that time, actually the ones that I've seen seem to be better. We did last weekend go down, and I believe we shut down 2 restaurants. Our inspectors will continue to go to restaurants, and if they are not following the rules, they will, as appropriate, issue them warnings or shut them down. We can't be in every restaurant every day, but we certainly will be out there enforcing that. So, I'm trying to allow the restaurants to gain an economic footing at the same time that we try to enforce safety. So we're doing the best we can. It's never going to be perfect. I would recommend that you or anyone else who sees a restaurant where you feel that they're not following the rules, call 311 and issue a complaint, and we will absolutely send an inspector out to inspect and issue warnings or shut down as appropriate.
And as a follow-up, thank you to that. Are the inspectors going out just on a roving basis and seeing what they observe, or are the visits that they're making based solely on complaints?
It's a combination. There's a schedule that they go out to specific restaurants and inspect for the full food safety as well. We don't want to have salmonella outbreak throughout this, but they also will go out in response to complaints.
Good afternoon. Dr. Farley, New Jersey officials have said they're seeing outbreaks among groups of people who have traveled out of state and returned. Are there any new indications that Philadelphia is seeing any of that from people traveling either like to Pittsburgh area or out of state and coming back?
We definitely have heard of people that got infected. It appears that they were infected through travel. And so we have issued recommendations, as you probably know, that for people who travel to high incidence areas, that they quarantine for 14 days. We did amend that because it became very impractical when Delaware became a high incidence area, say that people can continue to work if they wear a mask at all times for the 14 days afterwards. And we're recommending that people not travel to those high incidence areas.
Thanks. And you mentioned the death rate and that we haven't seen the increases here that other states are now seeing. Can you elaborate just a little? We've had questions from readers who see a lower mortality rate and think that means the threat of the virus is abating. Can you speak to that and whether that's an accurate conclusion to draw?
Yeah, so in other states, the first wave of the second wave, if you want to call that, was among relatively young people. And most of those young people are not going to die for this infection. And so they didn't see that many deaths. But what young people do is then they spread the infection to older people. And then when older people get infected, there may be a fair amount of time between when they first have symptoms and when they ultimately die from it. They may die 3 weeks later on a ventilator in a hospital. So the count of deaths always lags substantially behind the count of new cases. So for a period of time, we saw an increase in cases in Florida and Texas and Arizona, while the number of deaths was declining. And some people were trying to claim that this was not a problem. I was, like all epidemiologists, feeling like this was a problem, that the deaths were just going to come later. And sure enough, there is an increasing number of deaths per day in those high incidence areas. There's an increasing number of deaths per day in the nation as a whole. And I'm sorry to say that that's likely to continue to increase until their case count starts to go down.
Dr. Farley, the first one is, can you outline the metrics that Philly uses to add states to travel restriction lists?
We're looking at the case count over the past 7 days on a per capita basis. And I forget the actual number. I forget the actual number, but that's the metric, and I can give you more detail on that.
And is that criteria at all also related to that rate of spread or the R0 metric?
No, because this R0 is really impossible to measure. You can only estimate it. And we went with numbers that we could easily count and measure.
And can you clarify, I know you had just mentioned it, but the amendment to that travel restriction list because of the impracticality with Delaware?
Right. So previously we said anybody traveling to a high incidence area should self-quarantine for 14 days after they come back to Philadelphia. Instead, we said they should do that, but if they can't do that, if they have to work, and many people who have to work, then they should be using a mask at all times when they're at work. And in addition to that, if they develop symptoms, stop working right away and get tested.
I would like to know if you have any information on how coronavirus has affected the Hispanic community in Philadelphia, given that some of them are essential workers and they also have adverse living facilities or living standards.
So we certainly have had higher rates of coronavirus mortality and I believe cases in Hispanics than whites in the city, not as high as African Americans. I always worry a little bit about our statistics because I'm not always certain that they're necessarily going to be coded as Hispanic in our data. So I'm concerned. People Hispanic origin often are low income, and low income people are at higher risk. So we want to make sure that the prevention messages go to them as much as possible, especially people who have to work. So we have our safety precautions for businesses, and those safety precautions for businesses should protect the essential workers, including Latinos.
Let's go now to Martin Pratt at Philly YBN.
Thank you. Quick 2 questions. First, is there a list of the play streets that have the water, the 100 play streets listed somewhere on the website, or can I get access to that?
I believe they are listed on the website. I don't have that in front of me, but
Okay.
have you looked at the website?
Yes, I have.
You've looked at it and can't find it?
No.
Martin, we'll get that to you. Just shoot
Okay,
us an
thank you.
email and we'll.
Okay, thank you. And the second question is regarding for Dr. Farley. When we look at the symptoms of people who have survived COVID, we're seeing consistent symptoms that they're having. Has the city given any thought to creating some type of treatment protocol that the public can use? Additionally, there has been a lot of talk about mental health for victims of COVID, and they're not finding a lot of places that they can turn to. They're starting their own support groups and stuff like that. Has the city given any thought to that?
Let me say, we're still learning about the coronavirus illness. It's a new virus, and a lot of things we'll learn in the future about the long-term effects of this. That really needs to take place, though, in the medical care system, which the city in general does not operate. We have our own clinics, but we're a small fraction of the overall system. If there's something that, I'll be in contact with my colleagues in healthcare to see if there's anything that they're doing, but I don't see a role for the city in that right now. As far as the mental health, the Department of Behavioral Health provides services for people who have Medicaid, which is close to half of the city's population, and as well as people who are uninsured, who have behavioral health problems, a variety of behavioral health services. And so those services are there regardless of the cost, whether you're having mental health problems because you had COVID or you have mental health problems for 20 other reasons. And so I would encourage people who had COVID or having mental health problems to avail themselves of that. And I always forget the number, but there's an 800 number where people can call and get more information.